starting the recording session so that the students who are missing the class can listen. Today we'll start discussing about the posology and we will discuss especially very important different type of calculations. We will see the formulas present here like Clark's formula, Dilling's formula, Fred and Young's formula. We will try to calculate some allegation method, proof, period, percentage calculation, tonicity calculation, and other calculations also. Because these calculations are very important, we will discuss one on one carefully. So let's start focusing on posology. Poso means the word itself suggests how much. Logy means it and science. So posology is how much science. So you should know about posology. So poso means how much, right? Here you can see poso. And logy is science. It's easy to know. So it is a science of dose. So how much dose should be given to the patient was being determined by the factors of posology. So in smaller classes, we'll discuss it as a part of the posology. But when we go to the higher classes, the same subject was being studied as dosage regimen designing. Dosage regimen, right? So in dosage regimen, what do we have in dosage regimen? What is the strength of the dose? What should be the route of administration? And even what should be the frequency of the dose? So these things will be determined. What? Number one, strength, then route of administration, and frequency. Frequency means how many once in day, twice daily, thrice daily, whatsoever is there. Okay, so these all things are being discussed using the posology. Let's see one by one factors affecting posology. Then we can see the calculation part in detail. Okay, chalo. So first factor of the posology is very important. That is age of the patient. Depending on the age of the patient, lot of dosage forms, frequencies, and strengths are being changed. Because as we know, age is one of the important factor here in uh, governing the dosage form. The reason is because of underdevelopment of two organs, like what we discussed in earlier classes, that liver and kidney are very important in means of drug metabolism and elimination, as liver and liver enzymes are not well developed in the pediatric patients. The dose of the drug is taken less. And second thing, as kidney is not well developed in the pediatrics, so the elimination can be affected. These are the two reasons why the dose of the drug in children is very less. Okay, so pharmacokinetics of the many drugs changes with age. So while determining the dose of the drug, the age of an individual is having great significance. Children and even old age patients should be given the lesser amount of doses. So what is the reason why children and old age students are given lesser amount of doses? So the major reason here is in old age patients, like what I said, uh, wear and tear of these organs will be affected. Maybe because of the diseases, maybe because of the disease history, maybe because of their age and everything. So in children can tolerate larger amount of belladonna, for example, and digitalis and ethanol, whereas elderly patients are more sensitive to certain drugs. For example, hypnotics, tranquilizers may produce confusion state in the children. And so that such kind of example should be kept in mind. Okay, so please note down the major factor age and also remember certain examples. So what examples are given here? You can see here the major examples. Children and old age people need lesser amount of drugs when compared to normal healthy adult individuals. Children can tolerate relatively large amount of belladonna, digitalis, ethanol, whereas elderly patients are sensitive to this kind of drugs and it can cause hypnosis, it can cause tranquilizer effect, and in some cases confusion also. Okay, so this should be kept in mind regarding age. The first factor is age. Let's see the next factor. What is the next important factor? Is gender. So, as we discussed earlier, gender is also an important factor because many drugs, right, which are not supposed to be given in the women. So, women do not always respond to the action of drug in the same manner like the men. Example, morphine, barbiturates may produce more excitement before sedation in women. Special care should be taken when drugs are administered during menstruation, pregnancy, and lactation. With examples we have seen in last class, and we have even also discussed upon one point. I hope you remember what was that point. Yes, we discussed about the example of drug thalidomide, right? And I said this is called as what? No one was there in the class. The drugs which damage the fetus. What are they called? Hmm? In last class we discussed what are those drugs which cause damage to the fetus in pregnant women. No one are listening to class. That's the reason why you are unable to answer. ఏమంటామండి? Yeah, you can type and answer also. Just no answer in chat box. Yesterday we discussed, in previous class we discussed. Yes, no one can answer it. గుర్తులేదా? చెప్పొద్దు అనుకుంటున్నారా? లేకపోతే వాట్స్ గోయింగ్ ఆన్? ఐఎమ్ నాట్ అండర్స్టాండింగ్.
Teratogens.
Very good. Teratogens. And it's called teratogenicity. Right? Thank you. So we should be careful while giving drugs to the menstruating woman, pregnancy, and even during lactation. We discussed about many drugs like tetracycline, right? Like CNS depressants and many other drugs which are not supposed to be given in the woman. So there are certain drugs which are administered to the mother are capable of crossing the blood placental barrier. So such kind of drugs should not be given because they are going to affect the fetus. Example, alcohol, barbiturates, narcotics, and other kind of drugs, right? So please note down the examples of such kind of drugs. I have highlighted, right? Alcohol, barbiturates, narcotics, and many other. Even I will give you later when we start BPPK topics. I'll give the what kind of which drug in which stage of the pregnancy they are going to affect the fetus. Even that we're going to discuss, right? And here you can note down these points. Hypnotics, right? Some drugs which like alcohol, belladonna, ethanol, digitalis can cause hypnosis, tranquilizer, and other effects in the patients and చెప్తున్నాం కదండి. అది కూడా please note down as an example. See, next important factor, body weight is one of the major factor. Normal healthy adult individuals weighing 70 to 90 kgs daka okay. Below the 50 kgs, below the 40 kgs, the lean body weight is also problematic. And obesic patients also cause problematic because obesic patients low volume of distribution will be higher. If the volume of distribution increases, then other factors can also be affected, other kinetic parameters. So body weight is also a factor before calculating the dose. So age should be checked, gender should be checked, body weight should also be checked. Next, see, route of administration. Doses will change, dosage strength will change depending on route of administration, right? When you're giving the IV route, the same drug, the oral route doses will be higher when compared to IV route. In IV route, we will give lesser doses, right? So because there will be no first pass metabolism, there will be no decrease in the what can we say, the drug concentration, then many other factors. That's the reason when you are giving in IV route, the strength will be less. When we give the oral route, the strength will be more. Okay. So somebody are like texting, when is the pharmacology class? I clearly explained you. Let me finish up some of these ones. In November first week, you'll have the continuous pharmacology class. I don't know their name. Their name is not saved in my mobile, but they're asking, sir, when is pharmacology class? When is pharmacology class? Pharmacology class will be starting from November first week. We will complete the SUTIX, some major part of the SUTIX. Then you will freely listen, relaxedly you can listen pharmacology entire month and even the chemistry. So major portion of your syllabus will be covered from pharmaceutics and pharmacology. So both of them will be given importance. I don't know someone Sheikh who is this, but please note it down. I'm repeating it again. Your classes of pharmacology will start from the 1st November. So please don't ask again. Thank you. Okay, so route of administration is also very, very important. And IV route flow, the drugs given should be lesser in dose when controlled to oral route. Even controlled drug delivery low kuda, the route strengths will change. So depending on the type of drug delivery, is it immediate release, sustained release, controlled release, right? And what kind of release? Depending on that, the strength will change. Route of administration also is one of the factor. Next, time of administration can also change. So if we make already, I hope you know, age definitely the factor, gender can be a factor, body weight can be a factor, route of administration can be a factor. How come time can affect the strength of the drug, or the how much of the drug should be given effect? Yes, it's very important because basically, like we know that sunlight will have stimulant effect, and darkness is generally going to have the depression effect. So type of drug given varies on sunlight also, and varies on the time also. And many drugs, especially many diseases, their intensity and their frequency changes depending on the daytime. For example, if I say asthma, you don't get asthma attacks at evening 3 o'clock. You will get these attacks at early mornings. And for example, if I say a migraine, migraine attack you will not get in early morning. You will get in afternoons. As they prolong, these pain and intensity prolong. So depending on the time, time of administration is important because depending on the daytime, chronological factors will affect many of the diseases will change. For example, you can see here, see, the presence of food in the stomach delays the absorption of the drug. So certain drugs should not be given as soon as your drug food is taken, and certain drugs should not be taken in empty stomach. For example, if you say PPIs, proton pump inhibitors, you will take empty stomach, right? But whereas if you're taking a painkiller, if you're taking an NSAID, if you're taking an aspirin, if you're taking a Nimsulide, if you're taking ibuprofen, you're not supposed to take empty stomach because these NSAIDs are supposed to increase the this thing GI secretions, right? They are going to increase the proton pump and they are going to affect the acidity, increase the acidity of your stomach. Whereas so these drugs are not taken in empty stomach. So we know these basic things which we have already studied. So drugs which very effective when the one, so some of them are taken before meals and some are very effective when they are taken after meals. So irritating drugs, just like we discussed, should not be taken in empty stomach. For example, iron, arsenic, cod liver oil, and many other are taken after the meal. So some drugs are taken after the meal, some drugs are taken before the meal, some drugs are taken with the meal. So time of administration also plays an important factor. You should keep that in the mind. Okay. So environmental factor, just like I said, daylight is showing will show stimulant effect, and darkness will show sedative effect. Okay. So darkness shows the hypnotic. So when you are giving stimulating drugs, if you're giving in the night, the dose should be more. And if you're doing in the giving in the day, the dose should be less. And if you're giving the hypnotic drugs, you have the CNS depression drug. At night, the dose is less is sufficient, but at the day, the dose should be more. So amount of barbiturates required to produce the sleep during daytime should be will be higher when compared to be given in the night time. And alcohol is better tolerated in the cold environment than in the summer. So these environmental conditions also plays a vital role. So you should keep this factor in also mind. So age is a factor, gender is a factor, body weight is a factor, route of administration is a factor, time is a factor, environmental conditions are a factor. Then we have some other factors like emotional factor also plays a role in it planning the dose of the drug. How come an emotion affects the dose and the strength of the drug? Yet it is also going to affect because we know many of us knows about the empty drug, placebo effect, right? So drugs like barbiturates may produce usually prolonged effect in patient having, sorry, not this one, no, extremely solid. Yeah. So personality behavior of the physician may influence the effect of drug. If physician is saying that anyhow this drug is not going to work, you will die even you take this drug, then that drug doesn't work on the patient. Sometimes paid drugs are doctors are giving placebos and saying that this drug is wonderfully going to work. Literally we see the effect. So placebo effect is also plays a vital role. So emotional factors are important. Psychomatic disorders are very effective depending on the type of physician you're sitting with. So the females are more emotional than the male. So generally what happens, certain drugs are required in less quantity for the female and more quantity in the male. So even emotional factors plays a vital role, and the best example for the emotional factor is placebo effect. Okay. Next important thing is previous disease and present disease. So in certain disease conditions, the amount of drug given will change. For example, drugs like barbiturates may produce prolonged effect in patients having liver cirrhosis. The patient is not having cirrhosis, then barbiturate effect will be less comparatively. And streptomycin is excreted mainly by the kidney and can prove toxic if kidney of the patient is not working properly. So, in the case of patients with ESRD, end-stage renal diseases, if you are giving streptomycin, then it will be toxic because they cannot be eliminated from the kidney. So కిడ్నీ డిసీజెస్ ఉన్నప్పుడు కిడ్నీలో ఉండి ఎలిమినేట్ అయ్యే డ్రగ్స్ ఇవ్వకూడదు. దట్స్ వాట్ హీ సేయింగ్. So presence of disease when we are saying a factor, so any kidney related disease, we should avoid the drugs which are eliminated through the kidney. Renal elimination ద్వారా వచ్చేవి. So అలా you should keep in mind that disease also a factor in governing the route of, I mean, a dose at posology. Then drug accumulation is also a factor, and very important. Additive effect is a factor. Synergistic effect is also a factor, right? So how come drug accumulation is a factor? Let's move a little bit faster. The drugs which are slowly excreted may build up sufficient high concentrations in your body. In some cases, maybe due to the improper metabolism, maybe due to the improper elimination, or maybe due to the protein binding or increased volume of distribution, many other kinetic parameters are going to affect accumulation of drug in the body. So mean retention time in the body increases, MRT time in the body increases. If accumulation of the drug in the body increases, then the next dose should be given less. For example, if you are giving 10 mg ethanol, 2 mg of ethanol is already in your body, it's accumulated in the body, and next dose when you are giving 10 mg, it's automatically becoming 12 mg because already 2 mg is accumulated in the body. So this time again 20%, let's say 2 mg is staying in the body and 8 mg is eliminated. When you're giving the third dose, then literally it's becoming 14 mg instead of 10 mg. So 40% of the dose is increased. So that thing is kept in mind. What's now? Class will be. Class will be. Other here. Okay. So drug accumulation also plays a vital role. So that is very important. So when the total pharmacological action of two or more drugs are administered, sorry, accumulation, right? So it is repeatedly administered for long time. A drug which is slowly excreted builds up in the body. సో ఏం చేయాలండి? తక్కువ డోసెస్ లో ఇవ్వాల్సి వస్తుంది, లాంగ్ టైం దాకా ఇవ్వాల్సి వస్తుంది. That is drug accumulation. Next comes to additive effect, right? When two or more drugs are administered together, generally in some cases, in order to enhance the effectivity, then it's called additive effect. Example, combination of ephedrine and aminophylline can be seen in the treatment of bronchial asthma. So ephedrine and aminophylline both combined together, aminophylline is giving the good vasodilation, I mean, a good bronchodilation effect, right? So additive effect, name learned increases that additivity, increases the productivity, increases the efficacy, pharmacological effect of the drug. Synergism, when two or more drugs are used in combination, their action is increased. Example, this phenomenon is called synergism, right? And antagonism, synergism, the opposite, right? When two or more drugs are prescribed and one pharmacological effect is opposite to other. Example, giving acetylcholine and adrenaline, ACH and adrenaline will have two opposite effects. So, the opposite effect sometimes the effect of the drug can be neutralized, right? And some in many cases, this antagonism can be effective and useful also. For example, giving the milk of magnesia, it's a basic drug giving in the like in treatment of acidity, and some adsorbents giving in the presence of acid poisoning and other things is also sometimes intentionally done. So antagonism and agonism sometimes can be done intentionally also. If it's done unintentionally, it comes under therapeutic incompatibility also. So our dose, how much dose should be given. Posology will affect on age, will affect on gender, will affect on body weight, will affect on route of administration, will also affect on time of administration, will affect on environmental factor, emotional factor, presence of disease, accumulation of the drug, additive effect, synergistic effect, antagonistic effect. Now, very, very, very important factor, idiosyncrasy. Tachyphylaxis and idiosyncrasy, these two are very, very important factors which will affect the dosage form. Idiosyncrasy is also called as drug allergy. It's an extraordinary response to the ordinary dose of the drug given. This is called idiosyncrasy. It's also called as drug allergy. The word idiosyncrasy has been replaced to term of drug allergy, right? For example, small quantity of aspirin can cause gastric hemorrhage. Small dose of quinine can cause ringing in ears, right? So a small dose of penicillin can cause rashes and skin irritation in certain patients. This is called idiosyncrasy. So depending on the idiosyncrasy, the dose of the drug is changed in certain patients. So idiosyncrasy is also called as drug allergy, should be kept in mind. Example aspirin, example penicillin, example quinine can be remembered. Okay. Then drug tolerance and acute drug tolerance are important. Tachyphylaxis is called acute drug tolerance. Hope this is not given in this book, but you should know about the tachyphylaxis. Tachyphylaxis means blocking of the receptors. If the small amount of dose is given continuously in like small intervals of the time, then those receptors are going to be blocked. If those receptors are going to be blocked, if you are increasing the dose, decreasing the dose, what reversing the dose, whatever you do, your drug is not going to respond to those receptors. That's called tachyphylaxis. In tachyphylaxis, what happening? Your receptors are being blocked. Why receptors are blocked? Because you're giving the same kind of drug continuously in the small interval of doses, interval of times, then that's going to block the receptors. It's also called as acute drug tolerance. Please note down, it's not given in the textbook here. So tachyphylaxis or acute drug tolerance. Tachyphylaxis, it's also called as acute drug acute drug tolerance. Then drug tolerance is also given here. So when an unusual large dose of drug is required to elicit effect of ordinarily produced by the normal therapeutic drug, if a efficacy, if to treat a simple disease, if you want a small dose, but unusually large doses are required, then it's called drug tolerance. Generally, small doses are required, but you need more. For example, in cases of smokers, tolerance of nicotine is more. So small dose of nicotine is not sufficient. They have the more tolerance to nicotine. So we need to increase the dose of nicotine. And in case of alcoholic patients, tolerance to the depressants is more. So more amount of depressions will be given. So generally, doctors before giving anesthesia, they'll ask you these two terms: whether you are smoker, frequent smoker or not, and whether you are an alcoholic or not. So the reason why they'll ask this is to check out whether you are tolerant or not. Tolerant అంటే ఇక్కడ పాజిటివ్ వేలో కాదండి, టాలరేటింగ్ మోర్ అమౌంట్ ఆఫ్ ద డోస్. అంటే ఏ డిజీజ్ కి అయితే చిన్న డోస్ ఇస్ సఫిషియంట్, స్మాల్ is sufficient to elicit certain response, but that small dose is not sufficient in this particular patient. You need to give more dose to show the small pharmacological effect, small pharmacological response. That is called tolerance. ఇలా టాలరెన్స్ అయినాక acute tolerance లో you will get acute drug tolerance లో tachyphylaxis. First you will see the tolerance, then slowly those receptors will also block. More doses కి కూడా it will not respond, then we will call it as a tachyphylaxis, right? And the last factor is metabolic disturbances. So change in the water electrolyte balance, change in the acid base balance, change in the body temperature, change in the physiological factors, and many other changes are going to affect the dose of the drug which we are going to give. Okay, for example, salicylates reduces body temperature only in case of individual having raising temperature. If you are giving a paracetamol to a patient, antipyretic drug to a patient who don't have fever, his temperature is not going down within than the normal temperature, right? Allah, there are certain drugs which will affect only when you have certain disease. If not, they're not going to show any effect. So that is also going to show the effect during the designing of the dosage form. So remember the factors, please note down. They might ask questions from these type of things. So age, gender, body weight, route of administration, time of administration, environmental factor, emotional factor. No, type मार रहा हूँ. Environmental factor, right? Emotional factor, presence of disease, accumulation of drug, additive effect, synergistic effect, antagonism, idiosyncrasy, tachyphylaxis, acute drug tolerance, and metabolic disturbances. So these are the factors which are going to affect the posology or the dose. If you're okay with this, we'll move forward to the calculation part. Shall we? Yes?
Yes, sir.
Yeah, thank you. So before going to the calculation part, you need to know certain formulas. When we are going to use Clark formula, when we are going to use Billings formula, when we are going to use Fred's formula, when we are going to use Young's formula, when we are going to use Cowlin's formula, Bestow's formula, and calculation based on surface area. In below, I will take the important one: Clark's, Dealings, Fred's formula, Young's formula, and based on surface area. This fifth and sixth పెద్దగా అంత important కాదండి, but remaining four are like five are very very important. See, when we are using the Clerk's formula, it's very basic and very simple. You can see here when in this formula, when the weight of the drug is taken in lbs by 150 into the adult dose, or weight of the dose if it is if taken kgs, then weight into adult dose. This is the Clerk's formula. Dealing's formula, when we use this, is calculated when the child age is between 12 to 20 years, and then below 12 years you are going to use Clark's formula. Above 12 years you can use Dealing's formula. In above 12 years, age of the year, you write by 20 into adult dose. Age of the year by 20 into adult dose. Please note down the formula. Fred's formula, when the child is very small, when he is infant, less than 24 months age, right? 2 years age కంటే తక్కువ ఏజ్ ఉన్న పిల్లవాడు ఉంటే age in months by 150 into adult dose, right? And when the patient is between 1 to 12 years, you can also use one more formula, that is Young's formula. Age in years by age in years by age plus 12 into adult dose, right? So this is Young's formula. So you should know these formulas, and calculation based on surface area is also given. Body surface area of a child by 1.73 square meters into adult dose. Okay. So please note down these formulas. We will start calculation. Please note down these formulas. Young's formula, age of the child in years by age of the child in years plus 12 into adult dose. Okay, noted? Chal. So, if you are not noted, just take a screenshot at least. It will help you a lot. This formula taken.
Yes, sir.
Thank you. Okay. So, next, now we are going to see certain solved problems here, right? So, let me, oh my God, I think I should do here only. See the first question. See the first question here. Calculate the dose of the child of 6 years old for a drug given here, alanzopine, by Young's formula when the adult dose of the drug is 150. So adult dose is given. So adult dose entandi 150 mg is given. So what is the Young's formula? Child dose by Young's formula. ఇప్పుడే చెప్పానండి. చెప్పండి, what is Young's formula? Age of the child in years by age of the child in years plus 12 into adult dose, right? What is the age of the child given? 6 years by 6 plus 12 into 150. So 6 plus 12 and 20. 6 by 18 into 150. Yeah. Now you should calculate. The answer you should get 50 mg. Basic calculation part నేర్చుకోవాలి. So Young's formula into the age of the child by age of the child plus 12 into 150 చేస్తే you will get this answer, right? See the next problem. తొందర సాల్వ్ చేసుకుంటూ వెళ్ళిపోవాలండి. How will you calculate dose of a child who is 5 years in age? By Billings formula, right? Yeah. So what is Billings formula? Noted Billings formula. Age in years by 20 into adult dose, right? See, if you don't respond, I can't teach. So age in years. What is the age in years given? 5 years. So simply I'll write. I'm writing on the screen. Can you see?
Yes, sir.
Yeah, age in years, that is 5 years by 20 into adult dose. How much is adult dose given? 1 gram.
1 gram.
Yeah. So into 1, 5 by 20 into 1. You do this, you will get 0.25 grams. So basic multiplication, basic division, basic LCM, basic fractions you should learn. Without that, you're not going to calculate other calculations. Next, calculate the dose of child of 18 months and 24 months కంటే తక్కువ ఇచ్చాడండి. So he's asking us to use Fred's formula when the adult dose is 15 mg. So what is Fred's formula? Child dose in months by 150 into adult dose. So what is the child dose in months? Sorry, child age in months, 18 months by 150 into adult dose is 500 mg. Okay, so solve this. You should get the answer 60 mg. So where we are using Young's formula, where we are using Denning's formula, where we are using Fred's formula, is there shown. See the next calculation. How will you calculate the dose for a child of 7 years old? By Cowling's formula. Cowling's formula is age in years by 24 into adult dose. A is age of the child. Sorry, Cowling's formula is age of the child the next birthday. So మనం Cowling's formula ఇక్కడ రాయలేదండి. చూడండి Cowling's formula. I'll show you. See. Age at next birthday by 24 into adult dose. సో అదే వాడుతున్నాడు వాడు ఇక్కడ. So they said 7 years old అంటే for next year it will be 8 years. So 8 by 24 into 300. Why 300? Because dose of the drug is here taken 300. Next. See the next calculation. Calculate the dose of a child of 5 years old whose weight is 22 pounds and the adult dose is 600 mg. So how they are taking? Have a look. See, weight of the child is 22 pounds. So 22 by 150 into 600. These are so simple calculations. Just formula lo substitute cheyadame andi. See the next one. Calculate the dose of a child of 5 years old whose surface area is given. Right? See, if surface area is given as 1.5 meters square, age is 5 years, dose is 40 mg, then surface area of a child is 1.5 by 1.73 formula into adult dose 40 mg. ఇలా సబ్స్టిట్యూట్ చేసుకుంటూ వెళ్ళడమే. So these are the so simple and easy formula calculation part, but at least one question will be asked from child dose calculation. So please note down the practice this problem. If possible, I'll send a screenshot to it.